how are you viewing the opportunity to change the landscape of Indian healthcare leveraging AI?
So February 5th was Founders Day, and we launched something called Ask Apollo, which is the chat GPT equivalent for health. And yes, we are sitting on all this data. And what it's doing is it's making our doctors work harder. Let me give you an example. My father-in-law, if he wasn't an actor, he would 100% been a doctor. So what he does is he always, if he has a condition, he takes his reports, he puts them in chat GPT and now hopefully Ask Apollo, and then he gets the whole answer because chat GPT gives him everything. And then he takes that and goes to the doctor and questions the doctor. So when he goes to the doctor, he'll say, I know about this. Tell me more that you've studied. So now the doctors also need to up their game. And what will this result in? It'll result in much better science coming into play, doctors going into more detail, doctors finally being challenged. Otherwise, people in India think that they are God.
Yeah. Yeah.
So, dealing with that is also, something that they are going through now. So technology is playing a great role in improving the access to knowledge that people have.
Yeah.
The back end, it's doing a great job by helping the doctors get better outcomes for the patients in terms of safety and administering the right drugs. But it's also making the patients much smarter.
Yeah, absolutely. Your father-in-law sounds a lot like my wife. The one person, like I have a medical degree, I worked really hard for it, but she will never listen to me. Anyway, so it's an incredible opportunity of what India can do with, and I've got a signal that we need to take some questions. So, and remember, the best question gets a coffee with. Anyway, so please,
I want to talk about universal healthcare. And I know there are concepts of government hospitals and some pieces of it, but do you think India should work on a universal healthcare plan? I know we all talk about it being a right for everybody, but where is India on it? And then the second part, just on the whole data thing, I know there's some digital initiative on healthcare by the government. So is there some work to share private information also and make it something more publicly available so you could basically solve diseases with the amount of data you have in India?
Yeah. Wait, is this being recorded?
I'll take that.
Yeah.
So, yes, we have something called Ayushman Bharat, and it is phenomenal, but people don't know how to use it. Corporate India is also covered by insurance, but people don't know what they're covered under. This is something that people need to focus on. To first understand what your insurance policy covers. Second is use it, because it is so brilliant. Do you know Ayurveda is covered under insurance, but people hardly know it and they don't use it. And these are some things that people need to know about. Ayushman Bharat by the Prime Minister's scheme is fantastic. People in different states are covered under this and healthcare is free for them. So when you talk about universal healthcare, we do have something fantastic for people in India. They just need to come out there. And now with the private partnership that we have with the governments, we are able to create models that get better outcomes for the people than anywhere else. This is in the rural areas. And we did a study with McKinsey Health Institute on this. And now the model is scalable.